Hi guys, Tony Maritato here, physical therapist, and in this video I want to answer the question, how long after your total knee replacement surgery should you start physical therapy? The typical answer is the day of surgery you start physical therapy. The day of surgery you're going to have a physical therapist most likely come to your bedside. They're going to help you get up, they're going to help you negotiate, use the walker, move around the room, make sure that you're safe to return home. Many of the procedures nowadays are done on an outpatient basis at an outpatient surgery center. So you're going to be going home the same night of surgery. If there's a reason they decide that you need to stay longer, or maybe you're in a higher risk category, the surgery might be done at a hospital and you might have a 1 or 2 day stay, maybe a 3 day. Some individuals do transition to a skilled nursing facility if they're not able to return home. But the day of surgery, you will be on your feet walking and moving around with a walker or crutches. In the US, where I'm from, we typically see mostly forward wheel walkers. That means walkers with wheels in the front and slides in the back. If you need more stability, there might be a walker without wheels, but in Europe and some other countries, they tend to go to crutches instead of walkers. So it just depends on where you're from. But the day of surgery, you're going to be starting physical therapy. You're going to do ankle pumps. You're going to do some what we call long arc quad, short arc quad, and you're going to be moving around. That is important to get you up, build your confidence. The knee replacement itself is a very strong, resilient procedure. You're ready to start putting weight on that joint immediately. But what we need to do is help build confidence so that you know what the knee is capable of. There's nothing worse than being fearful that the knee is going to buckle or the knee is not going to hold you up. So as a physical therapist, having worked in those settings, I know the biggest thing is building confidence, making sure that you know that the knee can handle what it needs to handle. Now, if you have questions, if you wonder about the procedure, if you wonder about the rehab, if you wonder about what you should be doing before surgery, after surgery, whatever, as always, please post those questions in the YouTube comments. I read every single one of your comments and I appreciate them because they help me understand what questions you need answers to. In the meantime, if you like this content, please hit the thumbs up button, subscribe to the channel, and I'll see you on the next question.